Thank you, Bruce. It's very moving. Minority communities are also specifically targeted by big tobacco. Asian Services in Action once had a grant to provide tobacco prevention and cessation services to their constituents. However, because of funding cuts, they are no longer funded. I would like to introduce Michael Bayou, their executive director, who will talk about what that's meant to their community.
Good morning. I'm Michael Bayou. I'm Executive Director of Asian Services in Action. We're a community-based organization to help new Americans here in Ohio adjust and thrive in the United States. While legislation was passed yesterday giving the FDA greater authority to regulate the availability of tobacco products, it is not enough to stem the tides of big tobacco. Over the years, the tobacco industry has repeatedly sought out and targeted its marketing towards minority populations. They have been successful in recruiting Asian American youth to become their new customers. According to the National Youth Tobacco Survey, Asian American youth who started smoking from 6th grade to 12th grade grew by an astounding 7-fold. That's the highest among any minority youth. The organization Asian Pacific Partners for Empowerment, Advocacy, and Leadership reported that next to African American youth, Asian American youth have the second highest use of menthol-flavored cigarettes. These trends definitely need to stop. The cut to our nationally recognized statewide Asian American Youth Against Tobacco program has been devastating. Unless action is taken now to reinstate tobacco prevention and cessation funding, we are looking at reversing 5 years of hard work that has helped tens of thousands of Asian Americans across the state. We Ohioans need a fighting chance to counter big tobacco. For this reason, the state must reconsider and restore funding to save the lives of many Ohioans. Thank you.
Ohio's situation. No prevention programs. Tobacco is obviously easy for children to purchase. It leaves our children vulnerable to new products. In just the past couple of weeks, RJ Reynolds has released Camel strips and sticks. There are 2 new forms of dissolvable tobacco. You can see them up here on the table afterwards, that are to be test marketed here in Columbus, Ohio. Strips are mint flavored and made to dissolve on your tongue. They're just the same thing pretty much as a Listerine breast strip. The sticks are thin and stick-shaped. You place them in your mouth and let them dissolve. The sticks come at a time when manufacturers of cookies and candies are coming up with such products as Oreo Fun Sticks, Crunch Sticks, and Butterfinger Sticks. And both products are very easy for kids to consume. Camel has been promoting these products through multiple mailings to Ohioans for free products and buy one, get one free coupons and magazines to Ohio subscribers. In fact, manufacturers in the state of Ohio spend $1.5 million every day, that's in Ohio alone, marketing their products. Yesterday, as Michael referred to, flavorings in cigarettes became illegal because of legislation that was passed, giving the FDA authority to regulate tobacco. Unfortunately, that law does not cover products like the new dissolvable tobacco or the products that are up here, like cigars, little cigars, smokeless hookah, or pipe tobacco. These products are often, as you can see, blatantly kid-friendly, with bright-colored packaging, and flavors like watermelon, bubblegum, cherry, grape. Use of these products is growing, while the use of cigarettes is on the decline. Fortunately, there's an easy solution to these problems. One reason these products are so attractive to children is that the tax on them is low. Because lawmakers raised the cigarette tax in 2003 and 2005 without raising the tax on these products, it created a loophole, making the tax on these products less than half the tax on the cigarette. To help Ohio's children and counteract this perfect storm of pressure to use tobacco, we're calling on Ohio's lawmakers to equalize the tax on these 2 tobacco products and use the revenue to fund tobacco prevention and cessation programs like the fine ones that we are obviously hearing about today. Just by closing that loophole, the state can fund these important programs while reducing the youth users of these products by 25%. And it's a popular solution. Polls show that 73% of likely voters voters in Ohio support this plan. Tax all tobacco at the same rate. Our plan doesn't use any existing state money, and it saves lives. It just makes sense. Let's give our kids the support they need. We'd be glad to take any questions anyone has.
Case.
No, the administration has made clear that no matter what happens with the lawsuit, that they're not going to put any money in tobacco prevention next year.
If they fund the non-cigarette products, these other products, with the tax, even like the tax option,
To equalize the tax, if they equalize the cigarette tax now, it would produce about $50 million annually, which would bring back about the funding level we were at 2 years ago.
So wait, to follow up on his question, the Legacy Foundation won their lawsuit. That wouldn't provide a lot of money for these programs? I'm confused. I thought that's what the
No,
lawsuit was
he
about.
was asking if, depending on, well, if the Legacy Foundation won the court case, first of all, it'd probably be appealed again. Second of all, that money would go to the Legacy Foundation for, to be used in the state of Ohio. But unfortunately, the Legacy Foundation money would provide less than 2 years of what the CDC recommended. So it's temporary funding, and we are looking for a long-term funding source for this so that, and we're not just getting temporary money that's going to be used up again and then we're coming back again. But this kind of funding source would be ongoing without us taking any existing state money. Give us an ongoing funding source that would always be there, and at the same time has the good public health benefit of reducing the use of these products, especially. It would reduce overall consumption 13%. So everybody, adults, youth are especially price sensitive. So among youth, it would reduce their use 25%. So kind of a win-win.
But on the order of things, I mean, the Legacy Foundation lawsuit's $250 million. The state funding level that we're talking, you're upset about getting cut is by $6 million.
Well, we're getting $60 million, or the state's getting $6 million right now. That is woefully inadequate. The funding we were getting 2 years ago was about $50 million. Then it was cut when the Ohio Tobacco Prevention Foundation was dismantled. And that $6 million is what was being taken out of the lawsuit money. So we're hoping to at least refund it to the level it was 2 years ago. Ideally, we get to the CDC minimum, which is $145 million per year. That's
145?
$145 million a year is what the CDC recommends the state of Ohio spend.
That 17% figure that you threw out about minors smoking, being able to get cigarettes, is that, you said it's getting easier. Is that, or is that compared to earlier years? I mean, is it really getting easier? Was it lower level before?
Yeah. I can get you, I don't have those statistics right now, but I can get those for you.